Hi, Jonathan Zor here with another VCIC Humanitarian Spotlight. Through the Virginia Center for Inclusive Communities Humanitarian Spotlight Series, I'm interviewing past Humanitarian Award recipients who are demonstrating important leadership in response to the COVID-19 pandemic. Today, I'm pleased to be joined by Mr. Gil Bland, a 2015 VCIC Humanitarian Award recipient from our Tidewater chapter. Mr. Bland is President and CEO of the Urban League of Hampton Roads. He also chairs the Virginia African American Advisory Committee, serves on the Executive Committee of the Virginia Chamber of Commerce, is a member of the Virginia Complete Count Commission and the Hampton Roads Community Foundation Board of Directors, among many other affiliations. And so really grateful, given all you do, Gil, to have a few minutes of your time today. Can you speak from your vantage point about some of what you're seeing of the impact of COVID-19, especially on the African American community?
Specifically, and I know it's national news, but it's borne out in actual results. The minority communities, the brown folks of America, are being disproportionately impacted by COVID-19, in part because of what the health guys call comorbidities, and that is existing conditions. Secondly, because many of our residents in underserved communities live in housing neighborhoods that have dense population, social distancing just is not possible. And then we also suffer to some degree from health literacy or illiteracy issues. And frankly, just not knowing some of the ways to protect ourselves as properly as we can. So the Urban League is seeking collaboration with many to help educate, as well as test and share the information to hopefully expedite a healthier community.
Absolutely, and the Urban League does really important and meaningful work, and we're proud to be in partnership with you and the work of the League. Can you speak about some of the specifics that you're seeing at the Urban League at the national level, but also what you're doing in Hampton Roads?
Would love to. You named a number of the organizations I work with. One you did not mention, and frankly has become our key partner in this initiative, is Centera Healthcare. I'm fortunate to serve on their board. And Centera Healthcare is a major healthcare organization in the country, but they've also stepped up to the table in terms of this health literacy initiative. And we partnered with Centera Healthcare, as well as the faith-based community and other nonprofits and like-minded people. And we've started testing in the public housing communities, in senior citizen communities, and also in the homeless communities. These are folks who may not otherwise, be eligible for testing or know about testing, or frankly have transportation to get to testing. When you have drive-by testings, you don't have a car, that doesn't quite work. And public transit services have been reduced during this period. So it's been a wonderful initiative. We've tested across the Commonwealth. Centera has a dozen or so hospitals across the Commonwealth, and we've found like-minded people to join with us, to be influencers and people of trust, to say, please come out and be tested.
Really important, and I think speaks to the power of partnership, that when the Urban League and Centera and others can come together, we can see some great results.
Collaboration is the key.
Most definitely. For those who are watching this, who want to get involved, who want to do the right thing, whether that's volunteering or donating, what are some ways that you might suggest they get involved right now?
Well, in our case, if you're in the Hampton Roads area, please reach out to Urban League. We have a website, ulhr.org. My email, and I'm happy to share, is gilbert.bland@icloud.com. But, our entire group and the community is simply, we're working together. And I don't think you can find a way not to be involved if you choose to be involved. There are just any number of opportunities. One of our other partners that I failed to mention, and it's been a critical partner, is the food bank. The food bank, when we are doing testing, we're also handing out at least a couple of days of supply of food products. And there's been a wonderful embrace by the donor community to help offset some of the costs of securing food for the food banks, and that's been a wonderful partnership also. So we're providing testing, literacy, and food. And in addition, we're also setting up help desks to kind of be a one-stop shop for disseminating information and helping apply to, the variety of COVID-19 relief funds. And we hope to do that post-COVID-19 also.
Absolutely. And one of the things that I've really seen with this pandemic is that so many inequities that had already been existing and underlying are so amplified in this moment. So you mentioned food, you mentioned healthcare, you mentioned transportation. Internet access has been a big issue for folks. And so the Urban League's multifaceted approach with the different pillars, I think, really comes in handy right now.
Well, we have 4 pillars, and it's housing, education, healthcare, and workforce. And what you just described in the healthcare community, it's known as the social determinants of health. And frankly, only 20% of the length of your life and quality of your life are really impacted by clinical intervention. The other 80%, the things you just mentioned, transportation, education, housing, really account for the bulk of how long you live and where you live. Zip code, where you were born and where you now live. In some cases, there's a 20-year difference in lifespan.
Needs are really great, and we're so fortunate that you're in a leadership role, Gil, to be able to pull people together and leverage resources to make a real difference. Thanks for carving out a few minutes to chat with me today.
Thank you, and continue doing the work you do. We have we're all beneficiaries of what VCIC does.